Senator Cormann.
Thank you, Mr. Acting Deputy President. Today is a moment of truth. It's a moment of truth for Labor, and certainly it's a moment of truth for the Australian people, because today is the day when the Australian people will find out that Peter Garrett was right when he said that once we get in, we'll just change it all. Labor, before the election, was desperate to make sure that private health insurance would not become a political issue. It was the time of the Me Too policy approach. We support all of the positive initiatives of the Howard government. We support the 30% health insurance rebate. We support lifetime health cover. And the minister today confirmed that they did not tell the Australian people before the election that they would be making those changes which are about to be announced in the budget to increase thresholds of the Medicare Levy Surcharge. Now, earlier this year, Senate additional estimates. I was somewhat suspicious, in light of Peter Garrett's comments, as to what the new government's approach would be to private health insurance. Because when we last came into government, after an extended period of Labor Party government, the Australian health system was totally out of balance. Private health insurance membership levels were down at 33% of the population, and they went down to 30% before we were able to turn the ship around. So I thought I'd ask some questions. And the Parliamentary Secretary for Health and Ageing was representing the Minister for Health during Senate estimates. And I asked her specifically, would you be concerned if membership levels started to drop as a proportion of the population? And she said, quote, "Of course we would be." I followed on and I went through the series of positive policy initiatives of the Howard government which led to bringing the Australian health system back into balance, and I asked her to confirm the government's ongoing commitment to those measures, specifically in relation to the Medicare Levy Surcharge. I asked, the Medicare Levy Surcharge policy will remain in its current form. Senator McLucas answered, quote unquote, correct. There is no suggestion to increase the thresholds that you are aware of. Not that I am aware of. So that was not a totally clear answer. So I went back to it later and I said, I would like on the record, though, to get specific information whether there are no plans to change the Medicare Levy Surcharge from the current levels. Senator McLucas, we have answered that question. So no change? That is correct. So Senator McLucas, representing the Minister for Health in Senate estimates earlier this year, was very clear when it came to this point. She gave an indication to the Australian people that there would be no change. Now, what do we hear today? What have we heard widely canvassed in the media? The Medicare Levy Surcharge thresholds are going to double. Now, that is bad public policy, because that is exactly the sort of policy that will lead us to the disastrous circumstance that we found ourselves in 1996, when, as I've said, the Australian health system was out of balance. Membership levels will go down, and the Minister, in one of his answers today, actually said, yes, some people will leave. He didn't tell us how many people. What is the definition of some? How many people will leave? Minister, you haven't answered that question today at all. Now, some people will leave, the Minister says. So membership levels will go down, and we all agree. This will have an impact on accelerating further increases to health insurance premiums. People will leave, and this will put pressure on public hospitals. Public hospitals that are already under pressure, that are being mismanaged by Labor state governments across Australia, with people not being able to access the services they need. Now, if you look at what happened over the last 10 years, with significant increases in the membership levels in the private health insurance system, the private hospitals around Australia have taken responsibility for a dramatically increased share of necessary health care required by Australians. And what is going to happen now? Australians will have to leave private health insurance because Labor went back on its commitment prior to the last election. This is back to the future stuff. As I've said, the Howard government had to restore the balance in the Australian health system when we last got into government. Peter Garrett was right, as I've said in my introduction. Once we get in, we'll change it all. And tonight, when the Treasurer is going to put out the budget, we will all be able to see that that is exactly what will be happening from here on forward.